Welcome back to News On. I'm Miranda Khan. We now want to go back out to Dr. Rutherford. Thank you so much for sticking around. I just wanted to give you adequate time there to respond to that question. So, if I'm hearing, what you had to say and the other doctor, that, you both don't believe that lockdowns are the solution. We've also heard that sentiment echoed by the World Health Organization. So then the question remains is, what is the solution there? How do you find that balance again for protecting our most vulnerable when it comes to this virus, yet at the same time, making sure those suicide rates don't continue to climb, anxiety, depression, drug overdoses and whatnot, as you mentioned earlier?
Right. So in my opinion, we need to move towards addressing this virus like we do most upper respiratory viruses. We always want to protect the vulnerable people from other respiratory viruses as well. So still doing the things that we're doing with the social distancing and the masks, but also treating people who have this virus on an outpatient basis. So, for example, I diagnosed someone on Friday with COVID-19 at my office, and he was high risk, so I treated him. Doing okay now. So he didn't end up needing to be hospitalized. He did not need to go to the emergency department. What's happening now is doctors often are not even able to see the patient in the office, and when they see them on telemedicine, they pretty much just tell them, I'm sorry, just stay home until you can't breathe and then go to the ER. That's no way to practice medicine in 2020. So that's one thing. And then, hopefully we can stop testing people who don't have symptoms. The tests are not that accurate. There's something called pre-test probability in epidemiology, where if somebody doesn't have any symptoms and then you do the test, you can't trust the test. Or, if somebody came into my office and had flu symptoms, I would diagnose them with the flu. I wouldn't rely on a test, in other words.
Right.
So, many of the things that we're doing are it's confusing the issue, and we're not taking care of people medically. And so I think we just need to shift gears. We can still try to protect the vulnerable, but we certainly should not be closing schools. There's no science to support that.
Dr. Rutherford, thank you so much for sharing your insight with us. Really do appreciate it. Hope to have you back on News On. Appreciate it. Now we want to take a look at the economic impact of a potential lockdown and what that could have. As I mentioned, states like Michigan and Pennsylvania looking to lock down once again. Joining us now is Chief Communications Officer, Jobs Creators Network, Elaine Parker. Good to have you back on News On. So, let's talk about this, because there's talk now that people are so upset about this lockdown that's going to be taking place in Michigan that people are actually looking to get the governor of that state impeached. Again, we're talking about high schools and college classes moving online, bars, restaurants closed for indoor service. Gyms must be enforced. This is supposed to take place at least until December 9th, which isn't terribly long, but yet still could have an impact on some of these small mom and pop places for sure. What is your reaction then? We've heard from two doctors, and we just had on, that say lockdowns are not the answer there. So if it's not the answer, then why are states like this doing that? And in your opinion, what's the economic repercussions of that?
Well, look, when you say it's only till December 9th, it doesn't sound that bad until you think of the people who aren't getting a paycheck right now. And then it is really bad. The economic consequences, along with all of the other consequences from the drug abuse to alcohol abuse and kids missing school, those are significant societal impacts. We had unemployment rate back in March when all of this first started that almost reached 15%. I haven't seen that in my lifetime, probably not in my parents' lifetime. And in 6 months, we have seen the unemployment drop to 6.9% and 11.9 million jobs regained. And for the states that have these governors that continue with these draconian orders to keep their states shut down, I mean, look at New Jersey. It barely opened up, and now it's shutting down again. So you have to ask yourself, did their lockdown work? Is that the solution? Mm-hmm. I think when you hear somebody like Dr. Fauci out there changing his mind yet again. I think as Americans, at this point, we have got to get a second opinion from somebody like Dr. Fauci. He has changed his mind on everything from the seriousness of the virus to masks and now on lockdowns. And if I had cancer and my doctor kept changing his mind like that constantly, I would go get a second opinion. So I think the American people should stop listening to people like Dr. Fauci for sure at this point.
Well, but then I hear you. And again, just playing devil's advocate here, because I know he's received praise and criticism. But a lot of people said, well, you just heard those two doctors saying, well, we're starting to learn more about the virus. Some people have said it's mutated. Or following what other countries were doing. Other countries decided to lock down. Other countries decided to do a mask. Now, it's debatable whether or not that actually worked. A lot of people would argue that they didn't work, and that's why the World Health Organization changed its mind, saying, yeah, we've looked at it. We don't think it works. So, I mean, there are some people that would say, is that a fair assessment, that he was just doing, I guess, in other words, what other countries were doing as well?
Well, look, what I know is that small businesses have been the heaviest impacted on this, and there's 30 million of them in this country. They employ 60 million people. We do know a lot more about the virus now. We do know how to protect the most vulnerable, and the CDC has lowered the death rate across the board on every age group, with the exception of those over the age of 70. That is our vulnerable group, and we do know how to protect them. We can protect the few without having to isolate the many, because the overall societal impacts and the costs, not just economic costs, but societal costs. I mean, we've got 22 million missed cancer screenings this year alone because of COVID. That equates to about 80,000 delayed and missed cancer diagnoses. Cancer didn't go away. It's just not getting found because people miss so many diagnosis. We're going to have tens of thousands of people who are victims of COVID who never even have the virus.
Yeah. I want to get your reaction though. So why would, Governor Whitmer, for example, in Michigan, and I want to clarify when I said, till December 9th, that's obviously the state that I'm referring to. That lockdown goes into effect tomorrow. Why would you ignore advice? Again, this is advice from the World Health Organization, which people on the right have been very critical of, but now you have the World Health Organization saying, yeah, lockdowns aren't necessarily the best thing to do. Why would you do it as the governor of a state? If all these various experts are saying doesn't work, why would you do it then?
Look, Governor Whitmer is going to have to deal with the consequences of what she's doing to her state. Economically and the fallout there. I can't answer why she would do it. She's got to weigh a lot of all of the issues, from the economic issues to the societal impacts to the virus issues, and see how it impacts. But you can't just look at it in a vacuum and only look at the virus impacts. Again, the CDC has looked at the fatality rate, and it continues to go down on every age group across the board, with the exception of that vulnerable group. So Governor Whitmer has other options to look at, and she should do that, because our small business owners, people who need jobs, they need to get back to work, and our kids need to get back to school and have some level of normalcy. We can do that safely. We can do that by masking and social distancing and taking all the proper precautions that people who are not in vulnerable groups can re-engage in society. But we don't have to lock down an entire state to protect one vulnerable group.
Elaine Parker, thank you so much for joining us here on News On. Pleasure to have you. Hope to have you back on again.
Thanks so much.